Well, good evening. Welcome to the Enosburgh Select Board meeting on January 5th, 2026. We'll have people go through and introduce themselves, and we'll go from there. So, Nick Aldrich.
Jessica Eagles, Billy Joe Draper.
I'm Peter Letourneau, Vice Chair. And this evening, we've got public comments, and then we've got our ambulance director, Garrett Wolski, with budgets and personnel, executive session, Joey Clark, and from there, the emergency management janitorial building bids. So we'll start off with welcome folks, and who'd like to go first on public comments?
All right.
State your case and your name.
My name is David Trihorn, and my case has two things. What I want to do first is I want to thank the select board for the support with our skating rink. It's we've had a lot of positive comments about it, and it's up and going. It's warm. Skates are inside. It's all good. I'm thinking about an addition. I'll wait till spring. So the other thing that I wanted to, this is basically an ask. We are quite involved with lights in the park every year, every winter. And what I would like to ask is that if you, representing the town of Enosburgh, would consider putting in your general budget a reoccurring amount of money to help us with buying lights and supplies.
Did you have a dollar amount, Dave, that you want to pop in there? You got that?
No, well, let me first say that, so the village has been doing this for a number of years. And I don't know how long, but I know as long as I've been involved, which has been probably 4 years or so, they put $500 in their budget to be used for that purpose each year. Now, my take is, and this is the case with the village money, sometimes we need some, sometimes we don't. Because, of course, the business association pays for a lot of that. Last year, every now and then, we do need a substantial amount of money if we need to replace a bunch of lights. Last year, we replaced all of the lights on the sides of the structures, and that takes up about 70 strings. So that costs us about $1,400 to do those. So, getting back to the amount of money, I've kind of been thinking about that, and my thought is this: I think it'd be nice if we could do it. Maybe something like using the per capita information that we know. You know, the village has fewer people than the town. So if you vote, to my mind, if you folks would go like 750, I think that would help us big time.
Now, the thing is that the lights that are the amount that the village is doing, is that for the lights in the park, or is that the wreaths and everything? Or is that two separate things?
Say it again?
Unless you want these names until
We
he's
have a
here.
lights, there's a line for
Because
lights,
he should make it.
right?
Is it separate than the wreaths?
Yeah.
Like that
Oh, it is
color?
separate from the wreaths?
Yeah.
Okay,
So
yeah, we'll put something together.
that'd be great. And if you could do it as in the budget, so it's reoccurring, that would be super.
Okay.
Okay?
But no, we wanna thank you folks for the time and effort that you guys put in on doing that, cause
Always so
that's
pretty.
super. I mean,
It's been a good year, this
I've
one.
heard a lot of
Yeah.
really great things
Yeah.
about it, so,
yeah, good job, good project.
yeah, awesome,
Sounds good.
thank you.
Thank you.
Thank you.
Thank you both.
Yeah.
And the gentleman that just walked in on our board is,
Don't remember my name.
it's a new year.
That's right.
He's incognito.
Larry Jarvis. Sorry for the tardiness.
You ready for it?
Sure.
So I came this afternoon, this evening, for a request that I might be a little late with, but I'm gonna pose it anyway. I'm here on behalf of the Cafe Youth Center that we opened in Enosburgh a little over a year ago. We are a 501c3 nonprofit serving the youth in the greater Enosburgh area. We were hoping to have an appropriation line put into the budget of $3,000 to help support the youth center. We've been gratefully we've had grant funding to cover our funds, and we've been doing fundraising. And we will continue to do both of those, seeking grant funds and doing some more fundraising. But the appropriation lines would also just help us with our sustainability with serving youth. If you're not too familiar with the youth center, we see about a dozen youth on any day that we're open. And-
Doesn't, yeah.
Yep, and some days we see upwards to 24 in a day. Most of the youth come from the Enosburgh community, and occasionally we do see youth from other communities as well. We actually just made a move to a larger space. We were finding in our old space, we'd have so many youth in the area, in the room, that a few more would come in, they'd see how we were so busy and there was no room for them, so they would leave. And when our lease was up, we found an opportunity to find a larger location. We'll be making a new opening this weekend.
Where's that?
It used to be the Century
Oh.
21 building.
Oh,
It's right
okay.
next to the town offices. Yeah.
Has this been appropriations in the past? It's new?
No, it's new, so I explained to her that the deadline is November 30th, and now it's 100.
Okay. I was gonna say, I
Something
know we
they
had
don't
a,
realize, yeah.
we did this several years back, we tried to get a process to get them in.
Now, the thing is any of this part of the school funding?
No, we do have a partnership with the school, but it's not school funded. It's not run through the school. It's its own entity.
When you say partnership,
We have two different partnerships with the school. Their alternative program uses it during the school day, which has been a really wonderful opportunity for the students in that program. And the Leaps After School program uses it 3 days after school when we're not open. Our goal is to have the space be used as much as possible by youth in the community. So that's how we partner with them. And we've recently become the charter organization for the new Scouts troop in Enosburgh as well, and they will be using the facility on Tuesdays, provided it's large enough for them.
Heather, what did you call it? 501?
501c3, so it's the nonprofit. So we're a tax exempt organization.
I just missed that earlier, thank you.
Okay.
So I don't know, it's past the deadline and it's not 100 signatures, but I could drop off the signatures that we have now just to show that there has been some support. We've had a lot of positive feedback from parents and other community members and businesses. Kids are having a great place to be. We're working on, skills about community development, and we're bringing in community members to teach new skills within the space. We're going to be doing resume building with students and talk about job and career skills, as well as just a good positive place for socialization. which is where they're gonna do a lot of development and just maintain healthy livelihoods going forward.
What were the ages? Was it 6th
It's
through?
6th through 12th grade.
Oh, 6th through 12.
So it's not 6 years old, sixth
6th
grade.
grade. Yep. Yep,
And your
we,
position is, right, you're the director?
I am the board president.
So somebody else is actually on site?
We have paid staff on site. We have 2 members that are on site at all times.
Okay,
I volunteer as the board president.
gotcha. So the board president.
Yeah,
Okay.
so we have a 5-member board right now.
I just wanted to make sure because I didn't know if there was somebody over there like full time. Okay.
Happy to answer any questions if you have any about the center.
I'm glad to hear that it's going well. A year? You said it's been a year?
A little over a year
A little over a
since we've
year.
been having
Really?
regular programming. Yep, a little less than a year with paid staff. It's been, I've been working on this since 2019. I just, some of you might remember the Vermont Youth Project. I came to the select board several years ago about that. We just kind of came up with that. Through that, we've had youth part of the planning process in every single step. They've gone to the spaces and looked at the spaces before we rented them. They've helped to pick out the colors and the decoration and what are we gonna have in this space. They had voice in the grant process as well. COVID kind of set us back a little bit, but then we got on track in the last couple of years, and we've been very fortunate with some grants through the United Way and Vermont After School.
So it's not open during the day? No, so it's like what, 3, 4?
Right now, our hours are Fridays evenings, Saturday and Sunday during the day.
Oh, so not at all during the week, like Monday through Thursday?
All right. No.
Well, that's good though. I mean, it's good to have those weekend hours.
Yes, yep. And we've had parents be very grateful because they're working on the weekends, so this means that their children aren't home alone. Yes, they're old enough to be home alone, but this is a better environment for them. And we have food, and we have a working kitchen, and we teach cooking classes. A couple weeks ago, I taught how to make homemade pasta, and so the kids have been just doing a lot of homemade pasta. And
I may have to join on that one.
yeah, it was a lot of fun. I taught them how to make some vegetarian dishes a little while ago, which my staff was very surprised that the kids really got into it. So,
Oh, good.
yeah.
Good.
Thank you for
Thank
having me.
you.
And,
Good work.
yeah, reach out if there's any questions.
Okay.
Thanks.
Thank you, Heather. Dean?
The person next to us is Dean Wright, chairperson. Say hi.
Bye guys, drive safe, it's a little slippery out
Yeah, be
there.
careful.
By the way, I just want to mention that pertaining to an addition.
He wasn't joking, I thought he was joking.
No. Well, support. What I want to say is I think we're pretty much done what we need to spend on the shed, so.
I thought you returned
I did.
the keyless.
We had some door locking issues.
Okay.
And-
So you might get something different.
Well, I think we're okay.
Real keys.
A
Okay,
real
with
key.
keys, real keys. That's not a bad idea.
I'm in that school too.
All right, have a good night. Thank you guys.
David, sorry.
All right, any more public comment? I'm assuming that's what we're in. Seeing none, we'll move on to the ambulance. Garrett.
Is this executive Dean or no?
Not yet,
Not yet, okay.
but it will.
Okay.
Good.
Gary,
Good,
wanna
how are
come up
you?
also?
I'm gonna make all of the noise.
How are you, Garrett?
Good. Well,
We haven't seen any updated baby pictures.
I thought she was gonna be here tonight.
I was hoping she was gonna be here
I was told.
Man.
we found somebody to cover her for a while, so.
Time to hold the
I
baby.
am a hard out at 7 o'clock. I apologize for in the middle.
Just moving right
That's
here.
right.
Here, I forgot you.
We did do that when we put the,
We did.
yeah.
Okay, I could not remember
That
for
had
the
like
life of me.
45-ish hundred on
Okay.
it. And
I'm gonna update our board.
it was there and I was like, yeah, well, let's do that.
I thought we did it, but I'll update our board because I can't tell. I guess the one to do all that stuff. Hopefully it'll be. It's been a good truck so far. All right. So tonight, primarily it's mainly updates right now. We are going to discuss a little budget, but I'm still right in the middle of all the budget information and numbers. So the next 2 meetings will really be kind of diving into the budget portion of things here. But tonight we're going to go over some service updates. We do have some billing rates to discuss as we have a couple contracts that are coming up due. Some purchase items we're looking into for the year, and then a couple personnel things. So service updates, I haven't seen you guys in a while here, so the community events was a great success. We had a good turnout. Crews did very well. I'm very happy with the work the crews put into decorating the ambulance.
6 hours plus in putting on lights on ambulance, so I would like to clarify that.
Awesome.
Each year we're upping our game a little bit, kind of competitive with the other ambulance services, so
We like to be the top one.
yeah, we gotta be the best in there.
That's a lot of lights.
It was a lot of lights. We borrowed some from fire.
They had over 30,000 lights on there, so.
Holy cow.
Yeah.
That's a lot of
It
Scotch
took
tape.
them
Yeah.
44 hours
Electrical.
to do that.
Electrical.
We found electrical leaves a lot less residue on the trucks and
Yeah.
holds on decently well with the weather.
Yeah, that worked really
That's
well.
awesome. Good to hear.
So the holiday parades, we did the Enosburgh parade, we did the St. Albans parade, and then Franklin as well. And they all had wonderful turnouts there, so we were very pleased to do that. I applied for the services critical care licensure, and I'm currently with the state right now. I just got an email from the head of the EMS office at the state, Dr. Wolfson, who's just inquired about our QA/QI process for it. Tomorrow I'm going to email him back and just give him an update. We have that policy already in place. So in a nutshell, the critical care licensure is basically a level up from the paramedic licensure level. It allows us to do more critically ill patient transfers, I should say. They don't really have it established for us in the 911 setting, not to say that we couldn't do it, but it's primarily designed for interfacility transfers. So Billy Smith right now is one of our only licensed critical care paramedics. I just finished a critical care paramedic course down at the University of Florida. Now I just have to take my national board exam, and then I'm critical care licensed. But this would be a good kind of move forward for the service. Currently, there's only one service in our county that is critical care licensed, and that's AmCare. And we're looking to obtain our critical care licensure here as well. So that'll be a good kind of milestone for the services if we can obtain that. With that equipment purchase, there's not really a lot we need to purchase for equipment with that licensure because we do carry pretty much all of the medications we would require. There are a few extra that we're working with the pharmacy to see how we can purchase those things. A ventilator has been in discussion. It's not an absolute, but it's something that we're looking into. They do sell refurbished ones. I'm working with HealthNet. They have some that they don't use in their warehouse that they're going to give me a quote on to see how much they'd be willing to sell for. And then IV pumps as well. Jameson.
So when you,
Yep.
sorry.
Yeah.
So you're saying you don't have a personal license, you're talking about the service as a
Service,
whole?
yeah.
Okay, I was trying to
Like
understand the
you would
difference.
have your personal license
Yes.
as critical care.
Yeah.
So then,
So what's the real, I mean, this is just for my own curiosity.
ask away.
What's the real difference between the critical care and the paramedic? Like,
A lot.
oh, is there? So there's more you could do with
yes.
that way? Okay,
Yeah.
no, I'm just curious.
Oh yeah, so basically your scope of practice goes up significantly higher. The interventions you do, the medications you carry and do.
Really?
Um,
Okay, great.
Paramedic is kind of the most common top tier
Yeah.
licensure level that services have in the state of Vermont. There's a few, I would say at least a dozen that have it throughout the state. So like HealthNet. HealthNet is a critical care service.
Oh, okay, I didn't realize it was
Yeah.
higher than.
Yep.
and I'm assuming if it's higher, then it's a different rate. Okay.
Yes. Yep. your reimbursement rates would be higher because you'd be billing at the critical care level.
Okay.
And the other portion we're looking at this too is we're trying to help alleviate the hospital as well. So if there's a patient that's on medication or on a ventilator that's beyond the paramedic scope of practice, they have to send a staff member to go on that transport with us, which pulls that nurse from the unit for the transfer, and then they have to kind of jumble around patients to
Oh, it's good to know.
cover the unit. So this helps where now we don't have to do that. We can take this patient on our own. So technically I'm critical care licensed. The state of Vermont requires the board national certification in addition. So I'm gonna get that done. So then I've got my licensure, Billy's got his, and
Are you saying that it will
So
open
the
up
two.
to all the paramedics or just?
no, they
Just
would have to be
okay.
critical care licensed.
Oh, okay.
Yeah.
Got it.
But that is a stepping stone for them, so kind of in our policies, and I'll show you
Okay.
guys those
Oh, okay.
policies when we get there. The requirement would be for them to take a critical care course and then pass the national board
Okay.
exam, and then they can work with that. So,
Okay.
that's where we're at with that.
Is there any special schooling, like you said, you just went to school for it, do they
Yep.
have to do
Yep.
classes or?
So last year, I went to the University of Florida and did, it's about how long is that? It's a 4-month program. It's both online and in person. So I did the didactic portion with a live instructor, and then I had to go to Florida and work in their hospital, in their ICU, pediatric and medical ICU, and then we had a cadaver lab as well when we did our skills on it. And basically gave us that
Yeah.
experience, which was really good.
Nice.
Is that the only school or is that just the one that you chose?
Nope. I've actually done 3 critical care courses.
Oh, okay.
The one caveat to critical care, I've just never tested for the national board. You can use those hours that you do in the class towards your relicensure for paramedic. The only thing I found with those other courses is there was no hands-on portion to them. It was all just basically book work, and then, yep, you pass the test, here you go, you're a critical care.
So that school.
This one actually has a hands-on component that I like because your scope of practice goes
Yeah.
substantially higher, and I don't want to just be released to say, here you go, you did the test, figure it out.
Good luck.
Yeah, exactly. It would not be fun. Jameson is currently in an AHA class that's being taught down at Central Vermont Medical Center. This is a class to obtain his BLS Heart Saver Instructor course. It also includes ACLS, PALS, and PAIRS. So him having his instructor certification on this would be a huge alleviation for us because we don't have somebody currently licensed as an instructor. So we have to hire outside for somebody to come in and keep our licensure up to date at the paramedic level. So him having this instructor, we can now do this in-house for ourselves. And then also we're putting together so he can teach these classes outside as well. It would be run by the service. So once he's completed, then we're gonna go through the policies to see structured how we wanna do this and what do we wanna do for billing rates. I've had multiple phone calls from outside businesses, schools,
I'm
asking
taking
if
phone
we.
calls asking if we do them.
Exactly.
And if we don't, I'm sorry.
So there's a lot of interest out in the public that is looking for a BLS instructor. So this just gives us something that we can do to get the community involved in it as well. My goal throughout this is to become a heart saver community. There's a few communities in the state of Vermont that are considered a heart saver community, but basically that comes down to a number of available AEDs throughout the community, a number of CPR courses being taught throughout the community. It just kind of gives you a status and a stature for your town being a heart saver community. So I would love to see that here. There's a lot of work that goes into it to make that happen, but if that's something we could do, I would be absolutely thrilled to have Enosburgh be one. So he's currently enrolled in this program. He's expected to be done at the end of this month, and then he has to be audited by the school where he teaches a class, and then they ensure, yep, he's a good, thorough instructor. He's released to start teaching courses. Okay. So the other portion of this is just something him and I have been working on as to what the courses we would be doing would look like. This is just a very generic, general guideline as to what we're seeing. So this includes factors for cost of the student, cost for the instructor. The initial cost would be the big thing, the startup to this, is because you have to have the instructor equipment to do this, which means the mannequins and then the book work for the students to do. So we'll discuss that once I know for sure he's completed the class and we're good to go to start this process. You guys have any questions on that? I just want to give you an update as to what we're currently working on.
I have a super simple question. I'm assuming the B and A, it's basic, advanced.
Yeah,
Okay,
so BLS is basic life support, so that's your general CPR, AED use. Heart saver is a big one, that's kind of becoming the most common one.
but that's a basic.
Yes,
Yeah,
yep.
okay.
So our
Just trying to
beefers
figure
that are
out what
licensed
that
here have to do that heart saver version.
Okay.
Red Cross does a BLS CPR course as well. For some reason, I don't know, it's not recognized.
I
by the
believe
state
even
EMS
us as
office.
providers, not just beepers, now has to be heart saver when we
Yep.
go to renew all of our licensures and stuff.
Yep.
It will not be accepted by the state if it's not.
AHA.
Yep. So we have to do heart saver.
So that's the basic life support, and then ACLS, that's advanced. Essentially, at the paramedic level, we have to have our ACLS certification. Same with PALS, Pediatric Advanced Life Support.
Okay, pediatric.
That one's pediatric. And then Heart Saver is the first aid, AE, CPR book work. Yeah. So we'll discuss all of this once I know for sure he's completed the class, and then we can go forward with this. I don't want to make any investments until I know for sure we're done. You guys have any questions on that? I'm going to include this on the budget as well when we discuss budget. The end of year numbers, so this is just a little insight. We've put together the end of year numbers for our call numbers, so in front of you, you have 2025 call numbers, and then 2024 call numbers as well. Total calls dispatched, we were down compared to last year. Last year we did 1,411, this year we did 1,285. A big portion of that is the transfers. We were down Unit 3 for half of the year, so our ability to do transfers was limited because of the available trucks we had. So that portion was down. Our towns individually remained about the same. Being HIPAA compliant, this is pretty accurate with what I expected through the year for each town. Where we are up, and this is something we have to discuss once we get towards billing rates. So, use of mutual aid this year, we called for mutual aid 37 times. So if you go under the totals column, that's pretty much where I'm looking at everything, under the totals column, and then you see mutual aid under paramedic intercepts. This year we used mutual aid 37 times, last year we used them 41 times. So that's better, we called for mutual aid less this year than compared to last year. What did significantly change is the number of times we went to mutual aid. So the little note I wrote on the bottom, last year we went to mutual aid towns 65 times. This year we went to mutual aid towns 113 times. So when I say mutual aid towns, those are towns that we are not contracted with. So if we go to Sheldon, Richford, Highgate, Fairfield, not towns we're contracted with, but we're mutual aid partners with the other services, so if they need us to go, we go help them.
Now, I'm assuming them numbers are part of the 1285?
Yes,
Okay.
yep, that's part of the 1285.
Well, that's quite a jump.
Yep, so we went to mutual aid, almost double what we did last year. And then the other portion of that, if you look under paramedic intercepts, last year we did a total of 28 paramedic intercepts. This year we did a total of 56 paramedic intercepts.
Double.
Yeah. So we've done a lot more paramedic intercepts this year than we did last year, which we're grateful to do. That's why we're here. That's why we have a paramedic staffed every day, sometimes 2, sometimes 3. So we have that paramedic available for them if outside agencies need us. Any questions about the numbers?
always nice to see the comparison.
This is something I watch every month
Yeah.
and compare the previous months. There is one column added that we didn't have in 2024, and that's the SRT standby. That's something we started in 2025 with the St. Albans City PD, where we have a crew go, and if they're doing a raid, basically, yeah, like a warrant search or something, they need a ambulance service there with them.
Oh, gotcha. Oh, yeah.
So we did that 5 times this year, which they're very grateful. Every time we go and do that, the SAPD reaches out to us and says thank you, and they're very grateful for us providing that service for them.
Now, are any of the other ambulance services qualified to do that standby?
They could. So we have 3 providers who are certified at the tactical level. So like Billy has his tactical paramedic certification. Sam went through the course as well. It's like an AEMT level.
Yeah, he also had to do a board test too.
Yeah, I forget the exact name of the course, but it goes along those lines. And Jameson, the same thing.
Good.
So we have those members. He's TLCC.
Yeah.
He's not the focal one.
Yeah.
He is. I have my TCCC, but that's lapsed. I'm due to do my TCCC again. Again, it's a tactical component to it. It is something other services could get. I don't know if they have any certified members.
Yeah, that's nice to have that.
Yeah, oh god, yeah. They're grateful.
I don't actually know if any of them around here have anyone certified tactically. Ampere doesn't, MDR does not.
I couldn't say for sure. I don't know offhand.
No, I know for a fact they don't. Oh, that's crazy.
And then the only other thing on the numbers that I did note, Richford, we went to Richford 25 times last year. This year we went to Richford 88 times. So when it comes to the mutual aid, that is a number that has jumped up significantly. That's where that Unit 2 kind of helps. When we keep going to mutual aid, it's helpful to have that Unit 2 on shift, so there's always 911 available. Yeah. Questions? Okay.
So the percentage on the side is
Yep.
the percent per town.
Yes, yeah. So if you, that's looking at, of our total call volume, how much each town kind of impacts that percentage. So our primary one would be Enosburgh, at 48% of our call volume. And then second would be Franklin. Yeah, Franklin. And then third would be Berkshire.
What's the difference between total calls dispatched and 911 taken? Are you including?
So that includes transfers.
Oh,
that
so
includes,
everything.
Yep,
Okay. So
everything.
then
Whenever a
not just
detective goes out.
911.
Yep,
Okay.
exactly. That includes everything.
That's what I figured. I just wanted to see.
Yeah. Our next thing. So billing rates. The first thing I wanted to go over, our Richford ambulance service contract is coming up due, and that is our ALS intercept fee. We currently charge $300 for a paramedic intercept, ALS intercept. I need to renew that contract with them, but before I do so, I want to make sure you guys are okay with the billing rate, or if we want to change the billing rate. I have no partial to it. It's really up to you guys, what you want to do. To give you comparison, so looking at the numbers again, this year we did 55 intercepts for Richford. Last year we did 24. What we received in billables this year from Richford was $12,900 for intercepts.
Okay.
That's what that $12,900 is.
How long is this contract for? 5 years?
We do 2 years.
2 years.
Well, the 300 was, wasn't that increased from previously to?
When I first started here, we did.
Which was what, for
Originally, we did 250,
250?
and we increased to 300.
Okay. Which is still about at the rate, like if you were, would you suggest increasing it, or are you saying that it's still a going, I'm just trying to see.
I'm not
if-
opposed to increasing it. It's tough to compare us to other services because truthfully, there's extremes. We are, I would say, one of the lowest rates, if not the lowest rate of paramedic intercepts. We're contracted with Amcare where they charge us $850. Their normal paramedic intercept rate is, I believe, $1,400 for other services.
What would you think would be a reasonable increase if you were to put that out there? Like you're talking 400,
I was honestly thinking 350.
350?
That's what I was gonna suggest, going $50. I mean, everything's costing more for ourselves to
Right.
maintain.
Basically, what that's covering is the cost of the expense of the paramedic that's going on that transport.
That makes sense.
I'm not looking to make money off of that by any means. This is
Yeah.
more just to make sure we're covering the expense of that paramedic. We've had situations where that paramedic has had to go. They've had to stop at Northwest and then go to UVM with Richford.
Yeah.
That's typically a 4 to 5 hour turnaround time. Those costs kind of add up, and especially if we're using our equipment. That's where we-
Especially since it was $50 a few years ago, you know, so it makes sense.
Yeah.
Yeah, as far as inflation and all that.
Is that something we have to decide tonight?
We don't, but sooner rather than later,
Okay.
When's the contract?
the end of this month.
Yes, we meet every Monday this month, right? Yeah.
Garrett, what's a rough cost to do the intercept?
Paramedic's salary, I can tell you real quick.
14.
And you said equipment, is that like consumables as well?
Depending what equipment they use, so if they need to do like a interosseous access, basically if we can't get an IV and we need to drill a needle into a bone to get access, those alone are $90. And then the tubing and all that stuff, the medication, it does add up pretty quick, I would say. And then you have the truck with the fuel and everything, plus the other provider driving the truck to follow them, to pick them up at the hospital. So to give an example,
So you send one of your rigs to follow them, so then you can pick up your provider
Yep.
and bring them back into service
Yep.
as quick as possible.
yep, exactly. Yep.
And sometimes like if the call changes while you're en route and maybe Richard doesn't have that specific piece of equipment and maybe we didn't grab it right away, we can then easily pull over real quick, grab it from our rig and bring it into their truck. The Lucas has been a huge component with that sometimes for Richard as they don't have one. So it's just
They
trying to
do call
keep,
us quite a bit to use the Lucas.
yeah.
Oh, so you guys have been using it?
Nice.
Oh yeah,
Really?
well, I've used that Lucas so many times.
Cool.
Yeah.
What, 3 weeks ago we had a code. Yep, and I had it on that call.
Yeah.
Yeah,
We use
that was a
Lucas
call.
lot.
Huh.
Yeah, we've used Lucas. It's been huge help when we haven't gotten any backup sometimes, so it's great.
Yeah.
That's great.
So you're saying just to hold off on that for now? On that final decision?
Mm-hmm.
Okay. I'm still
You want me to
curious,
check
I think,
numbers?
I'm
Yeah.
just curious.
Okay. So this would be just salary, no equipment
oh,
for that transport. Now if they go to UVM,
But is that for the,
That's basic, that's not like workman's comp or anything, that's just hourly
correct,
rate.
that's regular hourly
but
rate.
is that for the paramedic? Is that also, because you're also paying the rate?
That's
and
just the paramedic, that's not including the
My
other
pay
provider.
going down behind them, the
Right.
link with that.
Right. Okay.
yes.
That's why I'm not looking to make money off them by any means.
Right.
This is just to break even with
Exactly. Yeah.
doing the trail.
Yeah, we want them to survive too.
Oh, absolutely.
Yeah, exactly. Yeah, we can discuss it.
Yeah.
Okay. Next thing, transport billing rates. I've had Comstar reach out. It's that time of year we need to look at transport billing rates, so I can get back to them. Again, this isn't something that we have to set in stone tonight, but something for you guys to at least start thinking about if we're going to make adjustments. So part of this packet, the first part is what Comstar sends me every year to let me know what Medicare is increasing for base reimbursement rates. The second page is what the top 50 average that they receive for transport services. And the third page, fourth page is what,
I don't
I
think
don't
we
think we
got
got the
that
back side. We only got front sides, we didn't get
I
back
got that one, but I don't have
well,
this one.
should be
We got
this
fronts
one.
and no back.
Yeah, I got one, I go straight to truth.
Nothing.
Yeah,
Pass
we
it.
didn't get it back.
So you're gonna copies or no?
No, it's
No,
okay.
it's fine.
I'll just pass it around, you guys can look at it. So I'll start with the front page.
You want this one?
No, we don't have it.
You got that one. not the
It's
back
this one.
side.
Oh, the back side.
Yeah, apparently my back page didn't come.
Okay.
I'll start with the front side though. So Medicare came back with what they're gonna do for base rate percentage increases. The state of Vermont, they're increasing 1.8%. Where the concern is, our premiums for our health insurance went up 20%, we are getting reimbursed 1.8%. Which makes it a little more difficult to budget. So what that means is their percentage that they're going to reimburse us, they're going up 1.8% on what their percentage for reimbursement is. Now, this back page is what Comstar sends me, and this is what the average top 50 for Comstar services bills. And the third page is what our current rates are. So to give an example, I'll start with BLS emergency. This one,
This last page. This one. That one, yeah.
Oh,
you just have a copy of reading this.
third page was something else.
Okay, so to give an example, on the fourth item, Enosburgh, Vermont BLS emergency base rate. The amount we charge, this is the last time we updated, was 2024 in March. Our current rate is $900. The Comstar average is $1,800. Now, it's difficult to jump that much essentially because realistically, we're not going to receive $1,800 back on insurance reimbursements. And the factor to include in this is what insurance doesn't cover is what suddenly becomes obligated by the patient. And that's kind of the ethical decision in this. Insurance does not mean they cover everything in full. And that's the hard part in this is, do I think we need to go up? Yes. Do I want to go up substantially? Absolutely not. So this is what, and I can, actually, do you mind making copies of
I
it?
can make copies.
So what does Medicare go by, or the insurances go by?
Each one's a little different. So Medicare is a national
Average.
insurer, and that's usually about 70 to 75% of our clientele are Medicare insurance carriers. The other ones like private insurances like Blue Cross Blue Shield, Cigna, MVP, each of theirs is a little different as well. Typically they reimburse a little higher, but statistically the percentage of patients that carry that insurance is usually less than 10%. And then the other one is Medicaid. Medicaid, there is basically no adjustment. You can only bill at the rate Medicaid allows. We can't go any higher. We can't bill the patient beyond what Medicaid will allow.
Can you with Medicare?
Medicare you can.
So if they didn't have everything covered with our new rates, they would be, sort of like an insurance, like we don't have.
Correct. Exactly.
So would you give a recommendation of what all of these, because personally, like, I look at this and I'm like, I don't know what they should increase, like, do you have recommendations for each one?
I do, but before I do those adjustments, I just wanna know if this is even something that we want to
Oh,
consider.
like, an adjustment in general, you
Yeah.
mean? Oh, okay. Thanks.
I'd just like to add a couple cents on that one. We don't see a lot of, correct me if I'm wrong, unless you see a different court than I do. People just aren't paying insurance and everything isn't paying, it's just, we're just writing it off. So it's kind of like a moot point. I mean, we want to collect as much as we can. And I think if they had the money, they probably would write us a check. And, you know, remember a few years ago when I tried to go after some of these with collections and I did like 300 mailings and we offered them payment plans as low as like $5 a month and I did not get one response out of all of those. None. Zero. And I had good mailing addresses.
So
People just
Medicaid
don't pay.
pays a percentage or a number?
Whatever they set the rate.
A percentage of it. So you're gonna get something more from that, not, the people if they're on the hook for more, you're probably gonna be writing that off, but
Right,
you're
exactly.
gonna get more if you increase that number
Right.
So
through
to
Medicaid.
give you an example, and this is basically a ballpark, I'm still waiting on the final end of year report from Comstar. Total billables, roughly 1.2 million last year that we billed for patient transports. What we've received back from insurance reimbursements and patient private pay is 687,000. So,
It's a lot.
Yeah,
Would it,
Didn't even know.
but if we increase our rates,
We don't
would
have to
we,
send it.
would you get a higher
They don't
percentage
wanna
out of
send
the
them.
insurance companies?
We usually send them 4 to 6
Yes.
months away.
yes, primarily the
For us,
private
there's no way
insurances.
we can
No
send
for
them.
Medicaid,
Oh,
for
right,
sure.
right, right. No, I see.
You
what
wanna
you're
Medicare
do
saying.
something
slightly.
life credit.
No, no,
private
I
insurances,
just
yes.
didn't realize there was that many.
Oh, so
But the portion to that is the primary patients we care for, the majority of what we care for are Medicare patients. And that's the hard kind of ethical dilemma, is that portion that Medicare does not cover, especially with the recent Medicare changes. That would be the patient obligation to pay.
Yeah.
And there are also different avenues. I'm speaking with Comstar about the possibility of how would it work if we were to start billing for non-patient transports. That takes up around 18% of our call volume is patients that actually aren't transported. So there is an avenue where you can bill for that. Medicaid sets the rate, and I believe the last I looked, it was like $430. But if they don't have insurance to cover that, again, that's on the patient, and I don't want to deter patients from calling us.
Oh, we don't bill those now?
No,
Oh,
it's
So,
like a med devices.
right. No, I didn't realize that there wasn't something that you could code it.
I mean, there is,
Medicaid, Medicare, and regular private insurances to cover that sort of stuff, or not?
Yes, yes.
Okay.
They just have criteria, there has to be a full assessment completed, including a full set of vitals, full body assessment. You have to cross all the,
Which is what you probably do anyway when you're,
correct,
you know.
yeah.
what are these two mileages? There's one Vermont mileage, no, one was no coverage for that mileage. Or- This is
this big.
the last page. So next, third one from the bottom.
That's insurance if they have no coverage. So if an insurance does not cover the mileage for ambulance transport, the rates are the same whether they have the coverage or not. We charge $21 per mile.
So that's about half of what so everything, yeah, we're about half.
Yeah. So, not a decision we need to make tonight.
No, I'd like to see your recommendations, knowing from your like experience and what you see and what you call, you know what I mean? Like, I mean, I can see just from what I can gather, like it looks like a small difference between the basic, but then with the ALS, it's like a $200, so that might be something that, you know, it's just, I don't know, yeah, I'd like to see your, what you think should
Absolutely.
increase or stay.
I definitely know we need to increase because everything else around us is increasing and we're not gonna survive.
Especially if the billing for the non-trans, I mean, that seems like that might be something worth looking into.
Okay. I'll put those numbers together and give you my recommendation, and then we can move on that. Awesome.
I like your little egg timer over there.
Right.
Good baby.
She might have to stick around for the rest of it. Keep the rest of it.
I mean, I guess.
What's on task?
You got it. It's on task.
I get off task easily too, though.
You stay for a whole movie?
I mean, I feel like I was bringing my kids.
I don't have an oven.
Oh,
I don't have it.
The purchase items of 2026, we'll discuss that at the next meeting. Those are just the items that we're looking at. We're currently, as I'm working on the budget, we're putting those together to give you guys an idea as to what those expenses are. The Montgomery contract is due in 2028, that's when that contract renews. I looked over their contract again, they require a cost estimate by the end of this month. So the next meeting, I'll have that out for you guys.
For
to look at.
2028?
2028, yeah, they
Oh.
require it a year in advance.
I thought that's what you
I
said.
think that can be very
I-
proactive.
They have one sentence in there, you need to supply by the
Okay.
end of January 2026. to them.
Yeah, it'll be 2028 before we know it.
I know, right?
I know.
That's what we said in
I'm okay to
2023.
skip over 2026.
Right.
2026.
Bakersfield's contract renews in 2027, and then Montgomery is 2028.
So we're not talking about the 2030s yet.
Oh, man.
That's weird.
Yeah, and then the other stuff is just personnel stuff.
Definitely.
Yes.
So you need executive session?
If you guys are okay with that.
Yep, make a motion to go into executive session
Okay. I know when I'm not wanted, I know that's about me.
for ambulance personnel, yes.
I'll second it.
It's been moved and seconded for going to executive for personnel
Thank you.
Have a good
reasons.
night,
Have a
guys.
good night.
Thank you, Kara.
Really happy, happy time out there.
Mhm.
Oh, did he want to keep that?
He is on his computer. I think he left it for you guys to see.
Oh, okay.
Oh, I think we all had one actually.
As I said, I got one.
Yeah.
Oh, you do?
Maybe that's yours.
Oh, he must have handed him out.
Yeah.
Got it.
All right, so we are on to the
These 2 weeks ago.
done with the ambulance. We're on to the Joey's. Got a letter here. Everybody have this letter on the.
No, I just
Okay.
printed one.
So he's just saying due to the shortage of help this summer and this winter starting too early. Himself and Lucius were unable to use up all their vacation time. So, Joey has 118 hours left. 78 hours over the 40, so we have a 1 week, 40 hours paid threshold. And Lucius has 89 hours, 49 over the 40. That, so what Joey's asking for is that we pay them for all their vacation hours, not just the 40.
When you say vacation hours, do you mean like, is that comp time included or is
No,
that?
it's just simply vacation.
Oh, it's just vacation?
Yeah.
So they're up to, how many weeks do they
They
get?
both get 4.
Okay, that's all I wanted.
They both get 4. Yeah.
And that's as high as we go.
So what is
vacation.
so is it like,
4 times 40.
huh?
For 40 hours per week.
No,
so-
like, so after, like, so they're at 40, but like, when do you get like your 2 weeks, your 3 weeks?
Oh,
So at 5, so you, if you're here a year, you get 1 week. And then at 5 years, you get 2 weeks. And then 10 years, 3 weeks, 20 years.
Oh, okay.
And we capped it at 4 weeks at 20.
Which is what they're,
Right.
and that's different than, like, that's not including the 5 sick leave.
Correct.
Okay,
They don't
So
put
they
that
still-
down as vacation.
Right,
It
right.
stays as sick, but they don't.
if they don't use it, then
They don't get paid out
okay.
for sick.
Just trying to put it all together.
Sure.
I'll move.
I'll second.
Alright, so it's been moved and seconded to pay Joey and Lucius for the full amount of vacation time that if not used.
Our guys.
Any discussion?
No, but I do agree, winter started early this year, or last year.
It's been a rough winter.
There's
The
a
cold, the
lot
rain,
of
the
sand been
ice.
used,
Oh my gosh, the sand pile took a hit.
so.
Yeah, it's crazy.
It's supposed to be gorgeous this week, though.
I can't wait.
Bonus, more
Um,
ice.
Any more discussion on the motion to pay Joey and Lucius for their full amount of vacation not used? Seeing none, all those in favor?
Aye.
Aye.
Any opposed? It passes. Okay. Perfect. Next on the agenda is the EMS building janitorial.
So I think I mentioned that, did I give that to you, Dean?
Yeah.
The quotes. So, we don't have to decide on the library tonight, that should probably go in for the general fund budget. But Brenda had asked a price if that was something we decided to do for the library. They clean their own library currently, the librarians. But I got a quote anyway. So Jim and Darlene Hall, who've been doing a fantastic job here, have decided to officially and fully retire. Good for them.
Uh-oh.
Yeah,
So that leaves us, with needing the building cleaned. And, Mark Rose, fire chief, had suggested that
All season
All
janitorial.
Seasons give us a quote. So I met with them a few weeks ago. And the good thing about them is, well, they're paid by a company, so workman's comp is on them. They bring in their own cleaning supplies, their own vacuum cleaners, their own brooms, whatever it is they need. Floor polishers, you name it, that's what they bring it in themselves. And, they take care of business. They do the village of Enosburgh, and they do the community bank next door. You know, Sarah Tugas, everybody must know Sarah from the bank. Her husband's generally the one that does it. I met with him, his boss brought him along. They showed great interest and
So there's 2 because one's for the library.
right, which can wait.
No.
oh, not 2 different companies quoting, 2 quotes from these
Right.
to do the 2.
Right, okay, so
Locations.
the library one can
I
wait.
get you.
It's just, this building is so huge.
Heavy use,
Every single day I have multiple bookings, which is great, you know, it should be. But the problem that I think we were running into with Jim, and I think it might have been frustrating for him, was Sundays. He liked to come in on Sundays, he liked to have an empty room, of course, and we had people using this back room for book club. There was sometimes potluck and big luck, and
Oh.
it was hard for me to try. maneuver them to like a Saturday, cause they had, you know, they wanted a certain day, which I understand. But Jim also had his days,
So,
so it became. a
so he
bigger-
cleaned once a week?
Sometimes if he thought, you know, cause he's here on Tuesdays, if he thought he needed more, he would stop in, but he typically didn't have more than probably 10 hours in a month.
Really?
Yeah. But I also think that because it's becoming more and more used, that it can use more attention now. Not, I mean, he did a great job. This place was, you know, when he cleaned out that big room, I think we all remember how cluttered it was with junk. And he took care of everything, and him and Darlene have done a great job. In fact, they even, I said to him one day, would it be too much to ask if you would take care of the poop bags? I need to ask, but I didn't have anybody to ask. He
The
goes,
pets?
I don't mind, I'm here anyway, I'm getting paid, you know, so he didn't, just very good natured
Yeah.
about everything you asked of him.
So it must be when we move into the armory, that'll also need some sort of,
That's good, that's a big room, nobody's gonna want to clean it.
oh,
I think that's gonna take like an hour's worth of writing on something anyway. That's a big room. Anyway, that's all. I had one other person, but it was just one person. She would have worked like Jim. It's just, I do feel it's becoming a big job.
So right now, the library staff takes care of it.
do they get compensated for that?
But they do it on their
Time?
hours.
Oh, okay, gotcha.
And she told me that they typically close anywhere from half an hour to 15 minutes early to tidy up. Like down things, put some stuff in it.
I think that would be nice to have dedicated,
Well, that's what I would, but that's a general fund thing.
right,
so,
right, right,
yeah.
yeah, I'm glad you got an estimate.
So,
When is Jim and Darlene?
his last day was a week ago.
So now no one's doing it?
No, nobody's doing it currently.
You got any spare time here?
When we're done, we're all gonna grab broom.
Yeah.
I could've done it last Sunday. I was home.
I mean, if that it seems reasonable, they do the village, like,
Well, I think they're trustworthy people.
right, that's,
I think Richard is just a very trustworthy fellow. Mark seemed to think so. I mean, he recommended them.
so we just need a
Well,
motion to,
we can give them a try.
yeah,
What was it costing us now?
For Jim, I mean, he was paid not quite $18 an hour. And he would put in 5 to 8 hours a month. And then Darlene would have some too. So,
So needless to say, this is double, triple.
it,
Yes,
Yeah.
but again, they bring in all their stuff.
right.
Now, would they be coming once a week? Is that what they do?
That's what the quote is for once a week, and he said, like, if we find, because of the use of the building, that we feel that it needs more, which I have tried to talk to some of the people that are using the building, especially like the potluck people, or like sometimes when, like if these ladies were to have something, and the other day, the exercise people were gonna have like a little party, I just said, try to help us keep it clean in between things, maybe push the broom around if you can see stuff. Take the garbage out. We're not asking you to take the garbage home, but we have a dumpster out back, and I just say things like that. And people have been very receptive to it.
Yeah.
so this is more of like an actual deep, like, let's get in there.
It sounds like
Yeah.
it, like he's
I think
talking
that's
about
good.
polishing floors and
Yeah.
things like that, so.
Alright.
I'll move. We're gonna have to get him in here.
On just the EMS building right now, right?
Yeah, let's just go with the EMS for now.
And just a side note, they don't touch the offices, each side is responsible for their own bays, living quarters, and offices.
Yeah.
It's just the bathrooms, this room, the big room in the hallway to the front doors.
Good.
Alright, it's been moved and seconded to have all season janitorial accept their bid $5,100 for cleaning the EMS building. Any discussion? Seeing none, all those in favor?
Aye.
Any opposed? We are good.
I think, didn't they have an issue with ants there?
We still have an ant problem.
Yeah.
I think it's the radiant. It's nice and warm down
It's
there. all the
more
time.
over on that side of the building,
It's
or-
kind of more toward, it's like in the bigger room toward the front door area for whatever reason. That seems to be, but I don't know if it's sometimes that's where the recycle is too. Maybe there's a soda can in there or,
It's too far to walk over here. It's a long way to
I
go.
don't, we do have an ant problem.
I don't know, we've had those ladybug issues, I've never had that issue, like this year, I mean, so, I think it's good. Have somebody out here.
We good?
I think Dean had one more thing from Joey in there that he
Yes.
wanted.
All the plowing.
Yep.
Alright, so we got Joey put together. So transfer from general fund for work and plowing for 2025. He came up with a total of 24,335.
And I put the past year down by your thumb.
And 2024 is 17,263. So,
And he does itemize on the other pages what they came down for and how much time they spent.
yeah. He's got 219 for moving blocks at the Opera House for Dairy Day. Hydro seeding the emergency service building, 715. Gravel pad for the armory for the warming shack, 674. Clean up and gravel for Rendon's dry hydrant, 2935. Paving project here to EMS building, 699. Drainage work at the Opera House, 479. Topsoil work for the EMS building, 2751. And plowing for 2025 was 15,860.
So on his budget, don't we usually just figure the plowing?
We put transfer to highway from general fund for plowing, but it does typically include all of these things. I think
Yeah.
we just generalize by saying plowing.
But on his, okay. But on his, I think, I don't know how, if it's high enough. If
Oh,
he's
you mean on
figuring all
his
these-
budget?
Yeah, on
Yeah.
his budget, we have to make sure he's planning, he kinda knows the plowing, but there's excess work here.
Yeah, so he put,
In 2025, he had 244 plowings.
so he put in his budget 12,000
Yeah,
that he was expecting to have us
Yeah.
pay.
I think everybody was telling us, that's low, Joey.
Yeah, right.
You can go up.
Yeah. And there's 244 plowings at $65 a plowing, which from what we've seen from all the bids we've looked at, that's pretty reasonable.
It is, especially here, because he does all the salting and stuff on this parking lot, which, it's a big parking lot.
Yeah.
And he takes care about back too, cleaning, keeping that clean in case we have a need for helicopters.
Yeah, he definitely has had excess work to do with some of these extra projects. So, sure, definitely needs that budget needs to be reimbursed.
Do we need a motion on this?
He would like one.
Alright.
I make a motion to accept the price Joey's got for transfer for work and plowing. We transfer from the general fund to the highway for work done for 2025.
I'll second.
It's been moved and seconded to transfer Joey's work total of 24,335.83 from the general fund to the highway department for 2025 work. Any discussion? Seeing none, everyone in favor? Aye.
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 Any opposed? We are good. Any other business to bring a,
If I do it just an executive.
so we need to go back and go in.
Yeah, it's just something little, but
I'll move it, we go into executive.
I'll second.
It's been moved and seconded, to go into executive. Any discussion? Seeing none, everybody in favor? Aye.
Yep.
Any opposed? We are in executive at 7:25.